Hello, and welcome to the Public Health Shift audio edition. I'm Nadia Tekkal. In this space, I read and reflect on each issue of my newsletter, creating a pause for public health professionals to think more deeply about how we work, what we prioritize, and what the current moment is asking of us. This episode is based on issue 17. Why public trust depends on systems, not communication. Trust is one of the concepts that comes up again and again in public health conversations. When trust appears to falter, the instinctive response is often to look at communication, how messages are framed, how uncertainty is explained, and how engagement might be improved. Those questions matter. But I've increasingly found myself wondering whether communication is sometimes treated as the starting point when it may actually be one expression of something deeper. For most people, trust in public health doesn't emerge from formal messaging alone. It is shaped through repeated interactions with systems, through accessing services, following guidance, navigating eligibility criteria, and observing how decisions affect different groups. When systems feel predictable and fair, communication can reinforce trust. But when experiences are inconsistent or exclusionary, communication struggles to compensate. Trust often feels more fragile during moments of transition or uncertainty, when guidance changes, resources feel constrained, or when decisions are experienced unevenly. These moments are often framed as communication failures, but they also point to deeper questions about how systems are designed, resourced, and governed. Looking at trust through a systems lens shifts attention away from messaging alone and towards the structures that shape experience over time. Structures such as governance, financing, workforce capacity, and coordination. In this framing, trust becomes less something to manage and more something that emerges from how systems function day to day. You might want to pause and reflect on a few questions as you listen. Where in my work do I tend to look for communication solutions first? What experiences shape trust in the systems I work within or advise? And what might change if trust were treated as a systems outcome rather than a messaging challenge? Thank you for listening. If you would like to continue the reflection, you can read the full version of this issue by subscribing to the Public Health Shift newsletter on www.nadiatekkal.com. Until next time, take care and keep questioning how we show up in our work.